Many people at a recent church event noticed something odd when Chrisean Rock showed up with her kid, who is almost 2 years old. Most people's attention was focused on her child, not on his appearance or clothing, but rather on the unpleasant sense that something was missing, while others were discussing her most recent song. People who knew Chrissy and her family were quick to notice the shift because the youngster appeared to be frozen in time, not much different from the previous pictures that were posted on social media months prior. The gathering echoed with a strained and uneasy attitude rather than a joyful mother proudly showcasing a flourishing child of development or growth. To make matters worse, he remained mostly still, avoided eye contact, and seemed disengaged from the outer world. A doctor with no relationship to the family publicly voiced his professional judgment when a video of Chrissy carrying her son into the church was made public. The infant may never learn to speak if treatment is delayed, the expert said. This professional judgment was not merely speculation. Rather, it was a sobering evaluation that quickly proliferated in internet forums, raising alarms. It brought to mind Blueface's. The mother chose to live stream her first moments after giving birth on Instagram, and while she appeared grateful and content, viewers noticed some subtle but alarming symptoms in her infant. The baby barely moved his head, showed no interest in his surroundings, and responded to the environment with little engagement. Despite rising worry, his cry was a piercing scream rather than the usual faint whimper, which only made his anxieties worse. Chrisean Rock frequently stated on tape that her child was fine. Many viewers were upset by the sound of the baby's sobbing, reverberating in the background, and they couldn't help but note the fact that she even justified getting Blueface's name tattooed on her body. As the infant developed at 8 months, there were concerning indications that he was not being neglected. He exhibited little interest in feeding and hardly ever reacted when a spoon was placed near his mouth. Most of the comments from worried. Fans were legitimate, inquiring as to why the child was so listless and why he wasn't reaching age-appropriate milestones. Chrissy took a defensive stance in response, calling the remarks unfounded drama and hate speech. She refuted allegations that her child was unable to speak, smile, or hold his head up, saying that although physicians had assured her everything was okay, the absence of any supporting paperwork left many unsure about the true situation. Observers also noticed physical traits such as a small head, low-set ears, and a flat facial profile, leading them to speculate that his peculiar sobbing could be associated with withdrawal symptoms. Things were made more difficult by Chrissy's sporadic social media posts. Others believed that if the medical team had reassured her, she would have provided evidence to calm the growing fears. Blueface expressed his opinion that Chrissy delayed surgery for their son's hernia until the condition worsened after sharing a post praising the child's speedy recovery. But after she released a video, everything seemed to go south again. Instead of easing concerns, the wobbly, uncomfortable steps raised more questions as her baby's first birthday drew near. Viewers saw a remote, sickly boy who was cut off from his surroundings rather than a healthy, developing child. The boy's movements were almost forced, as though he were being made to show growth in front of others, and he lacked the curiosity and enjoyment that characterized children of his age. Chrissy's connection with Blueface changed from being criticized to being genuinely concerned, and there were concerns about whether she was taking advantage of her son to maintain his fame. Toddlers that are prepared to start their second year of life typically look into. Some speculated that Chrissy's decision to become pregnant was motivated more by her need to preserve a failing relationship than by maternal instincts, given how upsetting the situation was for her and her son. Critics questioned Chrissy's parenting and voiced concerns about the boy's well-being, even though the majority of the responses were encouraging rather than critical. A close friend of Chrissy's who had known her in the past later came forward to reveal a personal side of fatigue and annoyance that lay beneath her public image. Despite appearing overwhelmed, Chrissy chose to remain in denial as the child's condition gained greater attention, refusing to seek assistance. She eventually stopped posting images and videos of her child online, which many believed was long, overdue and necessary to meet his needs. The decision was unexpectedly supported by many who cared about Chrissy and her son, but when they reappeared at a church event, it was clear that the youngster had not changed much from his contemporaries. He was quiet, still, and emotionally aloof. A devastating picture that made anxieties worse. Many believe that the child's health problems throughout Chrissy's pregnancy were directly caused by the chaos of her drinking, smoking, and fighting. With Blueface, Chrissy has admitted to having reservations about becoming a mother. and even brought up abortion, but after the baby was delivered, his condition was inevitable. After seeing her grandson's failure to identify the child she had hoped for, Chrissy's mother and longtime critic Clarissa Blueface also voiced her opinion. Chrissy's public life, which included motivational posts and music promotions, appeared to be at odds with her son's deteriorating health. Chrissy continued to reject any concerns, asserting that she was strong and that everything was fine, despite the mounting panic that drew together supporters, medical professionals, and complete strangers to urge her to prioritize medical attention. This child needed help, not more public spectacles. Her remarks, which emphasized the urgent need for compassion and honesty outside of social media and stardom, struck many as deeply poignant. This child's story goes well beyond the usual celebrity turmoil and public spectacle. For a little child, never chosen to be enmeshed in such chaos, it is a potent reminder of the terrible truths that neglect and instability can impose. He did not ask to be born into an uncertain world where his parents' struggles and personal disputes take precedence over needs, but he is the one who has to live with the results of decisions made long before he even was born into a world of conflict, criticism from the public, and emotional upheaval. Unknowingly, this youngster is at the heart of a story that the adults in his life have entirely made up. From the beginning, his environment has been unstable, and his mother, Chrissy, exposed herself and her child to the harsh criticism and high expectations that come with being famous by making her pregnancy and early motherhood experiences public. The situation was exacerbated by her tumultuous relationship with Blueface. Recordings of her drinking, smoking, and arguing during pregnancy raised concerns and criticism that she prioritized appearance above health. The health of the unborn child was mostly neglected during all of this commotion, and he is still suffering from the effects of those early decisions nearly 2 years later. His withdrawal and detachment are more than just signs of developmental delays. They are an indication of something very serious at a time when most children are ready to explore, communicate, and grow up. Concerned voices are not merely expressing opinions, they are pleading for acceptance of a youngster who struggles to engage with the world on an emotional and physical level. Chrissy's public defenses and the criticism she receives online are less significant than the action she is prepared to take for her son's future. She set aside her need for recognition and her well-preserved appearance to face the reality that her child urgently needs professional care. The likelihood of long-term injury increases with the length of time she ignores the problem. Chrissy's resistance to acknowledge the seriousness of her son's condition only serves to heighten anxiety and uncertainty. But every child should have the chance to thrive. Early intervention can change a life. Her evasiveness implies that she is still hiding behind a meticulously constructed online image, avoiding confronting the situation. The child's father, Blueface, has also been instrumental in this unfolding narrative. He has periodically stepped into the general population to share their opinions on the subject. His few well-intentioned public statements are usually flimsy, attempts to control his image rather than genuine pledges of dedication to his child's welfare, and these uncommon appearances provide little proof of his actual active involvement in his son's life. This gap is not only obvious, but it also raises grave questions because it implies that the father is more focused on maintaining his reputation than on providing for his family's needs. Saying yes once in a while is only one aspect of being a parent. Another is consistently providing the child with emotional and active support. But Blueface's behavior so far points to a degree of passivity that further muddies the already precarious atmosphere this young boy is growing up in. His absence in significant ways conveys to his son a painful and subliminal message that he is not a priority, which goes beyond simple neglect. For instance, both parents must provide stability and certainty to a child who has emotional or developmental difficulties. This apparent neglect from a father figure can have a big influence on a child's sense of safety and self-worth. Furthermore, Blueface's reticence in the face of mounting concerns raises serious questions about his readiness to acknowledge the seriousness of his son's confusion and instability can result when a parent doesn't directly address and support their child's needs, leaving the child to handle challenges on their own. Such neglect has serious and enduring emotional and psychological repercussions that often affect the child's future relationships and capacity for trust, in addition to the emotional ones. He has occasionally downplayed or avoided the problem. In public, losing out on crucial chances to speak up for his child's growth and well-being. Blueface's lack of involvement affects the practical issues of parenting a child who might require extra care. Setting up daily activities that promote development, such as therapy sessions and doctor's appointments. Time, effort, and a willingness to adapt and learn are necessary for this responsibility. Blueface is not completely embracing these obligations, as evidenced by his limited apparent involvement, which puts an excessive strain on Mother Chrissy and may jeopardize the child's chances of receiving early help. A father's role is more than just biological. It also involves involvement, presence, and protection. In addition to impeding the child's development, Blueface's seeming refusal to completely engage in his son's life also weakens the bond between parents. Successful co-parenting requires cooperation. If one parent retreats or avoids involvement, the balance shifts, creating a void that could ultimately lead to increased instability in the home. Blueface highlights an important topic. The infant is positioned between two parents who, at times, appear more focused on upholding their public identities than on the well-being of the very life they created. The child's prospects of thriving are put at risk by this absence of genuine parental support, which raises the question of what will change moving ahead if Blueface wishes to have an impact. Words are insufficient. What is needed is action, commitment, and a genuine desire to be the father his son so desperately needs. Although this boy's life shouldn't have been a spectacle or a forum for public debate, he nonetheless attracts attention because of the people responsible for his care. If both parents can take the necessary steps, own up to their mistakes, and get their son the support he so clearly needs, there is still hope. However, if they ignore the warning signs, the youngster may continue to suffer greatly. The choices Chrissy and Blueface make in the following months will now determine the future. The internet is still trying to figure out how to help, so this narrative is far from over. Those who ought to nurture and care for the youngster are ignoring him, keeping him confined to solitude and silence. The majority of the world is watching to see if these people will accept accountability, take charge, and provide the assistance this youngster so much needs, or if they will keep turning their backs on them until the chance to assist them passes.